Welcome back. Philippine healthcare providers face the perennial problem of accessing updated clinical data and health resources. This data gap is born from limited digital infrastructure and fragmented information systems. In light of this, there is a glaring need for evidence-based resources and technology solutions that can ensure the quality and consistency of care. The Vice President of Sales at Wolters Kluwer Health, Asia Pacific, Norman Deery, joins us on the show tonight to discuss what can be done. Hi, Norman.
Hi there. Thanks for having me, and it's a real pleasure to be here today.
Right. So in a perfect world, I go to several doctors. I don't even have to sign or to update my records because every time a doctor tells me this is what I need to give you, these drugs, when I go to another doctor, he will have access to those records, and there's little chance of misdiagnosis or giving me new drugs that will that will not be consistent with former diagnosis, right?
Right. So I think you opened up with in the perfect world, and unfortunately today we're a long way from that. So one of the things that, if I take a step back and think about what it is that we at Wolters Kluwer do from a healthcare perspective, it's reaching towards the goal that you're talking about. But at this point, I don't actually need to know or have, from a infrastructure perspective, access to all of that information. So let me maybe paint a scenario, if I may. You wake up and you're not feeling well and showing some particular symptoms. One of the first things that many of us do, we jump on and we do a search to see, well, what could I possibly have? And one of the problems with that, one of two things happen. If I'm very positive, I'll look for the things that I really like it to be. And if I'm a very negative person, I think, oh my God, it's the worst thing that I could have. So off I go to see my hospital or my clinician. And, we expect, doctors today to have all of these answers. But the reality is that with the advancement in healthcare changes, every 73 days information is doubling. And it's really difficult for the limited number of clinicians, particularly if we look at the Philippine market, where we have 4 clinicians to every 10,000 patients. It's very difficult. So where do we come in? We then provide what you rightly called out at the start, evidence-based information at the clinician's fingertips. And you might be surprised to know, but today 60% of questions that go unanswered during a consultation. So we're really putting all of that latest and up-to-date information into the clinician's hands across all of the hospitals and the networks that we're supporting today.
So you serve big, small hospitals, even small clinics, they can have access to that kind of service?
Absolutely. So the solution that we provide, and one of the challenges you called out at the start was around infrastructure. The great thing about the solutions that we provide from Wolters Kluwer really require very little or often no infrastructure. If I have a mobile phone, a laptop, or a tablet, I can easily access the latest information that's updated on a daily basis.
So you don't even have to know the history. You just need to have access to the latest studies or the latest clinical reports to be able to provide answers to those 60% of the questions.
Absolutely.
We don't have that today?
But here's the problem today. Today, how do I get access to that information? There's so much volumes of information today. So perhaps I jump on the internet. One of the problems, the biggest problem, you have no idea where that information is coming from, who developed it, and is it the right action to take? What we do with from Wolters Kluwer through UpToDate, we actually provide from specialists who provide all of the evidence-based information. It goes through a very rigorous editorial process on our side, which really differentiates us from everybody else, frankly. And I know now as a clinician, and we've had clinicians come back to us and say, it really feels like I have all of your 7,000 to 8,000 specialists over my shoulder supporting me
Wow.
when I'm during my consultation.
So Norman, this is like a very smart medical Google.
You could put it that way. The power of Google is the search engine.
Right.
The power that we have is the content. So whatever you look for, it's been tested, it's evidence-based, and you can trust it. I don't have to think, do I need to validate this somewhere else? I can trust the content that I have. And today, we have over 2 million clinicians who are trusting and using our information. And if I was to bring that home to the Philippines, we have today over 20,000 healthcare workers who have access to these tools today.
Yeah. Norman, you're sort of, I don't know how to feel about this, because honestly, when I think about going to my doctor, I'd expect him to know everything, right? But again, that can be a misnomer in today's world, where you're saying the speed of innovation, and even in medical technology, it's amazing. And you can't expect all doctors to know exactly what you need. So this kind of service is very useful, especially in the Philippines, where you might be talking to a clinician in an island somewhere, right?
But what a great scenario that you brought up. So we've been working with the Philippines and the Department of Health since 2019, where there was some joint studies done, particularly in the areas that you're talking about, in those rural areas. And there were studies done by Dr. Antonio Dan, who's very familiar to many people in the Philippines. And it actually showed that the access to information rapidly helped clinicians make the right decisions at the right time, and often prevented people having to go for extra tests or even longer stays in hospitals.
So you don't need internet to access this.
Here's what happens. You need a connection, obviously, to get the information onto whatever device you're using. But the beauty of, one of the challenges you have in the Philippines and a number of other countries, sometimes even in Singapore, where you have interruptions to those servers. What you're able to do with UpToDate, you're able to actually download that content to whatever device you have. Oh. And the next time you get a stable connection, it will just synchronize and update the latest content. So you might be 2 or 3 days out of sync, as opposed to, if you're using textbooks, you could be years out of date. That's the magnitude of the difference.
What is the costing of this kind of service? Is it something that even any doctor, any clinician, any hospital can afford?
So we have, like I was sharing, so if I focus on the Philippines, we have many of your major large hospitals and extensively work that we're doing with the Department of Health, and that's continuing to grow. Costing is really relevant to the size of the hospital, how many doctors you may have, and I would call it a very affordable solution. But it's really about what's the return on the investment, and one of the key things about when you're looking at cost, is how does it help me have fewer medical diagnostic errors. We have data to support that 92% fewer medical diagnostic errors can be obtained using UpToDate. 52% fewer unnecessary tests. All this helps to particular hospitals, particularly in the public sector, where I'm reducing my costs. And 37% of the time, so here's the interesting thing, 37% of the time, clinicians are telling us they're actually changing their decision. Doesn't mean they had the wrong decision, but they now have access to some new information to suggest there's a new treatment or perhaps a new drugs that may be available for that particular situation.
Norman, I'm thinking the need for this at the LGU level, where you have barangay health centers with doctors and nurses doing their thing. What is your plan on providing this service to all of the corners in the Philippines? How are you intending to deliver?
Well, we're on track, and we're working through that today. If I think about one of the the visions or the missions that I know for the Philippines is about giving equity of care, the same amount of care regardless of where you are in the country. This is frankly one of our global missions. And when you have two visions and missions that come together, that's when the greatness starts to happen. We have been working significantly, as I mentioned, since we've done those studies, and we are in a significant amount of your rural areas today, and that's growing as we speak. In fact, frankly, I have the team who are in the Philippines only this week having more discussions.
Thank you so much, Norman, for everything that you do, and thank you for joining me on the show tonight.
Thank you so much for your time.
And that's your Business Outlook. I'm Salvi Duplito.